Good afternoon, everyone. I'm CB Mamaril, and on behalf of the National Coring Center for PHSSR here at the University of Kentucky College of Public Health, I'd like to welcome everyone to today's webinar as part of our PHSSR Research in Progress series that will focus today on modeling supply chain system structure to trace sources of food contamination. And so before we get started, I'd just like to draw your attention that today's presentation and speaker bios are available for download if you look at the resource box in the top right corner of the screen. And so to give everyone first an overview of the flow of our webinar today, I will be first introducing our presenters, and they followed by the presentation proper, after which I will be introducing our commentators, followed by their commentaries. And if we still have time, we will open the webinar to questions from the audience and participants. So it is our pleasure to introduce you our presenters for today's webinar, beginning with Dr. Stan Finkelstein, who is a senior research scientist in the MIT Engineering Systems Division and associate professor of medicine at Harvard Medical School. Dr. Finkelstein's research has focused on evaluation of medical practice and technology, and most recently has concentrated on public health systems and practices. From 2007 to 2013, he led the Centers for Disease Control and Prevention grant entitled Linking Analysis and Measurement to Public Health Emergency Preparedness Systems, Engineering Systems Analysis, as a part of the Harvard Preparedness and Emergency Response Research Center. Stan is also founding director of the MD-MBA Joint Degree Program at Harvard. Dr. Finkelstein is also an author of books and over 100 research publications. He holds a master's degree from MIT in chemical engineering and an MD degree from Harvard Medical School. Our other presenter, Abigail Horn, is a doctoral candidate in the MIT Engineering Systems Division and has previous research experience in informatics applied to public health, including work contributed to a data extraction and modeling project to improve the survival of critically ill sepsis patients, which has led to 2 peer-reviewed publications. Ms. Horn is a quantitative modeler of complex public-private systems, working at the Venn diagram intersection of operations research, management, and social sciences. Abigail's doctoral studies at MIT focuses on using new framing and modeling methodologies founded on mathematical modeling as well as broad systems thinking to improve the efficiency and outcome of foodborne disease traceback investigations. Abigail has also received an advanced studies degree in bioengineering systems from the MIT Portugal program, which she completed during a Rotary Ambassadorial Scholarship. So, Stan and Abigail, I turn it over to you.
CB, thank you very much. I'd like to add my welcome to those of you who are joining the presentation. I'm going to just offer a few words of context and turn it over to Abby Horn for the main part of the presentation. Not quite 10 years ago, my MIT colleague, Professor Richard Larson, who is a specialist in operations research, and I decided that we would initiate a research program on systems thinking and approaches to try to mitigate the effects of infectious disease. And our initial foray into that area related to outbreaks of influenza. We engaged a number of MIT and some Harvard students and colleagues in our work. And as we continued to pursue that work, initially supported by the Sloan Foundation and then later by the grant that CB mentioned from the U.S. Centers for Disease Control and Prevention, we decided at some point that we were interested in broadening from our initial focus of pandemic flu. And we, with some advice, we decided we would look at foodborne illness and looking at the possibility of rapid traceback of contaminants in foodborne illness. And we were thrilled that Abby Horn, who had just joined as one of our doctoral students, was interested in focusing on that topic as her doctoral research. We are really grateful to PHSSR and the Robert Wood Johnson Foundation for giving us this opportunity and supporting our work. And I would just add that Abby and I had the privilege of attending the Keeneland conference last April, and it was easy for us to see that our piece of research is kind of different from a number of the others that PHSSR has supported, and we're especially grateful again for this opportunity. So Abby, please go ahead with the main presentation.
So, yeah, we'll be talking about our project. The title of our project is Modeling Supply Chain Structure to Trace Sources of Food Contamination. And let me just say that this is in the event of large-scale, multi-state outbreaks of foodborne disease. So really what this means is that we're developing a set of procedures to identify the source of these large-scale outbreaks, and to do so much more quickly and more effectively than is currently done today, taking into consideration the FDA's extremely limited resources. So as we've talked about, this is a unique project within the PHSSR funding base, in that we're coming from an engineering department, and we're using modeling perspectives and approaches from operations research and other similar fields. And so given that, we like to frame this problem in terms of another application of operations research in a very different context, but a similar type of problem. And that is the theory of optimal search that was invented by Bernard Koopman during World War II. We're having trouble advancing the slide from our computer. All right, great. So to strategically search for enemy submarines in the North Atlantic in World War II, Koopman invented this theory of optimal search. And this was an anti-submarine warfare problem that involved searching over the two-dimensional space of the ocean surface, coming up with prior probabilities about the target's location, phasing updates, and a resulting search in zones that were deemed likely to contain what was being looked for, where the allocated search effort was a highly nonlinear function of the updated probabilities. In other words, in a way that could not have been expected without performing these detailed calculations. So our goal in our project is to develop a theory of optimal search for the source of an outbreak of foodborne disease. Before we start explaining exactly how we're going to do that, or how we're doing that, we need to provide some background on the foodborne disease outbreak and investigation process. Many of you who are coming from, especially public health agencies, are probably very well familiar with this process, but we'll provide some context through an example of an outbreak that we'll actually use, that will carry through the webinar. So we'd like to talk about the 2006 outbreak of E. coli in spinach, which many of you living in the country are familiar with. And the known impact of that outbreak was great. So there were hundreds of documented reported illnesses and many thousands more likely unreported illnesses, 3 deaths, and cases across 26 states in the U.S. So this is the kind of scale of the outbreak, of the type of outbreaks that we're looking at, where we have a single source of contamination and a broad distribution that makes it very difficult to pinpoint the location source. The question we like to ask here is, could damage have been prevented? And to answer that question, we first look at the contaminations timeline. So starting on August 17th, the first case was laboratory confirmed. That meant the case had gone through multiple laboratory tests, and it had been confirmed that they were associated with this outbreak strain. But that first case actually reported symptoms beginning on August 2nd, And what that means is that they ate the contaminated spinach a few weeks earlier in late July. And of course, a few weeks before that, the spinach was contaminated in the field. Now, what about the investigation timeline? Well, the investigation didn't officially begin until September 8th, according to the FDA published records. And the investigators weren't sent out until September 14th. And it wasn't until September 17th that the FDA announced an advisory against all spinach. So we can see that by the time this advisory was announced, all the significant contamination that was in the spinach had made its way through the supply chain. And after this point, it wasn't, the spinach was wiped off the shelves, but probably wasn't contaminated. Of course, yes, the FDA, after extensive further investigations, was able to confirm the farm of origin in Northern California. But the point here is that there is a huge lag between awareness that there's a problem going on. So on August 17th, when that case was laboratory confirmed, and then the investigation officially beginning and investigators being sent out. So we'll talk more about that lag in a few moments. But first, we want to give a little bit more background on the whole foodborne disease sphere. So right now, there's a large focus on outbreak prevention. And working in the prevention space, we have microbiologists and environmental biologists who are concerned with determining the root causes of contamination in the field and in the processing centers. In addition, current federal initiatives to prevent foodborne disease outbreaks have been focused largely on prevention efforts. So many of you are probably familiar with the 2011 Food Safety Modernization Act, whose rules are still being developed and finalized today. So all of these efforts are vitally important to making food safer to eat, but the problem is that they don't provide the tactical support necessary for a response to outbreaks that have occurred when these efforts have failed. And in addition, despite these efforts at prevention, the impact of outbreaks remains high and is actually still increasing. So every year in the U.S., we have millions of illnesses resulting from foodborne disease, hundreds of thousands of hospitalizations, and estimates of 3,000 deaths, with many billions in costs to healthcare. And the majority of these outbreaks are actually unsolved, so we're not able to identify where they started or often even what the food item responsible was. And this is the subset of outbreaks that are identified in the first place. So there's a whole other set of outbreaks that we don't even detect. And so to help solve these cases, we're looking at tactical response to outbreaks. So response to outbreaks that have occurred already. And within that, there are multiple opportunities for improving the outbreak response system, and we can kind of divide them into two major categories. So the first is really recognizing that an outbreak is occurring, and this is done through surveillance, and this is outbreak identification. And then the second is identifying the food and location source of the contamination through an outbreak investigation, and this is the outbreak traceback process. So first we'll talk a little bit about outbreak identification. Well, currently this is a part of the current response strategy, and there are multiple national labs and surveillance systems that are involved in identifying critical clusters of cases of foodborne disease. And the most important one for foodborne disease is PulseNet, which what pulse a system of national labs that coordinated by the CDC that perform molecular subtyping, also known as DNA fingerprinting, of foodborne disease-causing pathogens. And so, yeah, PulseNet is the most important for foodborne disease identification. In addition, we have an emerging field of digital disease detection. So this is incorporating information from social networks such as Yelp and Twitter to help improve earlier identification of an outbreak. And this is an active emerging research area, and one of our commenters, Jared Hawkins, is very active, and his early models are showing some great success in detecting cases and identifying outbreaks earlier in a way that supplements existing efforts through systems like PulseNet. But we still have the problem, once we've detected an outbreak, where is it coming from? And that's, as we said, traceback investigation. And the problem with that traceback investigation is current methods are really still slow and resource intensive and often unsuccessful. And there are a number of reasons for this. Some of them include the fact that they rely very heavily on in-person data collection, so sending investigators out to the field to collect data. There's not a lot of use of modern data and analytics, and they're limited by delays between the initial case reports and then the launching of the investigation, as we saw in the timeline for the 2006 spinach outbreak. So let's talk about that delay a little bit more. The traceback investigation doesn't officially begin until a critical cluster of cases has been confirmed to be linked to a single outbreak strain by the PulseNet laboratory system. So while this is eventually very important that we are able to confirm that these cases are attached to the same outbreak, this can limit the start date and therefore the resolution date of the outbreak. So to illustrate this, we can look at this figure shows us the pathway from contamination to illness to confirmed outbreak and confirmed outbreak to resolved investigation, so the entire outbreak timeline. And currently, the investigation only begins, as we said, when this critical cluster of cases has been confirmed through PulseNet. But we believe it could begin earlier. So as soon as we know that there are some cases of E. coli, we haven't, for example, with the 2006 E. coli spinach outbreak, before we have these cases laboratory confirmed, but as soon as we know through initial analyses. And so we advocate leveraging these initial case diagnoses to enable an earlier exploratory investigation of convergent sources of contamination. So this would be in advance of sending out investigators to collect records documenting product pathways. And it would be through a low-cost, low-commitment computer model, which would identify and rule out possible sources early on. And we believe that this exploratory investigation could help to prioritize leads early on and enable a faster resolution of the investigation. And just to make it clear, eventual confirmation through PulseNet is still a very important part of the process, but we're advocating looking at using a computer model to explore some of the potential sources earlier on in the investigation. And to kind of illustrate the benefits, we can look again to the 2006 E. coli spinach outbreak. So the figure that we have here represents our probabilistic estimates of the lower bound, upper bound, and average number of illnesses that may have been avoided if the traceback investigation commenced by the time a cluster of 10 cases of E. coli had been preliminarily identified through the earliest laboratory results instead of waiting for confirmation of the cluster by the PulseNet system. And we can see that those numbers range from 110 to 19, but regardless, there's definitely a benefit there. So for the rest of the presentation, we can talk about how we're doing this and how we're approaching this problem. And our main research question is very straightforward. It's how can the process of tracing the source of an outbreak be sped up? And to answer this question, we look at the various pieces of information that we can utilize to help us. So first, we start with prior information from past outbreaks, where we've seen outbreaks in the past, information about causal factors, what leads to outbreaks, current consumption rates, etc. And then add to that the fact that we know that investigations are occurring over the supply chain. So we should leverage what information is known about the network structure of the food supply chain. And then in addition, we have to take into consideration that these supply chains are dynamically changing. They're imperfectly understood due to companies holding their own supply chain data closely. And this information kind of evolves as the search continues, and therefore the method should allow for dynamic updating throughout the course of the investigation. And so this naturally leads into a Bayesian updating network approach. And we'll talk about what that means now. So here we provide a very stylized example, a toy example, to illustrate our modeling approach. We have here a very simplified network example that we can say this represents the network of distribution aggregated into just 3 layers: farmers, distributors, and retailers, for a single commodity. So imagine that this is the network of distribution for spinach. And say that we know that farm 18, this farm circled above, is the source of the contamination. Well, through the network, this farm is able to reach these 6 retailers that are highlighted in these circles below. And that should come up in a moment. And of these 6 retailers, only 3 actually report illness. So as is very common in public health, there's great underreporting of illness. So right now, we're left with a problem where we only have 3 reports of illness, and we want to formulate a backward tracing problem where, given these observations, and given our knowledge of the structure of the network and the flows through the network, we want to determine which of the set of farms could have possibly reached those 3. And of that set of possible farms, what is the probability that those possible farms provided to those 3 retailers? And what that can look like, we can see in these 3 figures here. Now, we start with going from left to right, 1 retailer reporting infection, 2 retailers reporting infection, and 3 retailers reporting infection, where the third graph represents the situation shown in the previous slide with those 3 retailers. So as the case count increases, the accuracy of traceback increases, and with 2 retailers reporting infection, we're able to reduce the number of possible farms down to about half, as we can see. And with only 3 retailers reporting infection, we're able to reduce the number of possible farms down to just 3. And of those 3, 1 is twice as probable as the other 2. So, of course, this is a toy example, a stylized example, but this is an illustration of our modeling approach and the results that we hope to achieve through this methodology. So now we'll talk about that methodology in some more detail. There are three main modules in increasing complexity that we use to explore this problem. The first one is, as we introduced a few slides back, looking at prior probabilities about the outbreak source location. So this is independent. This is not taking into consideration the knowledge about the network structure. It's taking into consideration other factors that can be used to determine the set of possible outbreak source locations and determine the probability that any of these locations is the source. Then our next step is to start incorporating information about the network structure and develop analytical models that look at stylized network structures, kind of like the one we showed just a couple slides back, and to use these kind of stylized models to come up with exact results and algorithms that will lead to new insights into the relationship between the structure of the network for different types of foods and the accuracy possible, the possible traceback accuracy. And then after we've developed that intuition, we're developing simulation models that can include a lot more of the true system complexity. So we'll talk about all these three steps in a little bit more detail now. So starting with the Bayesian prior probability, we've developed a model that works to identify the set of feasible outbreak origin locations and then to assign relative risks according to these three risk dimensions. The first, current consumption, is if there's 5 times more spinach that's being consumed from Northern California than from Arizona, there's a proportionally higher risk that that spinach contains a contamination. Then the second is contamination causing events, so observations of events that are known to have caused outbreaks in the past. So, for example, if there have been observations of wild boars roaming through the fields in Monterey County, we might want to increase the probability that there is a contamination originating in that region. And then third is the epidemiological association. So this is the strength of the historic epidemiological association between outbreaks in a location and a specific pathogen commodity pair. So where have we seen spinach and E. coli outbreaks coming from in the past? And so just a figure to show what the data source can look like to feed into this prior probability model. We see here shipping records for the volume of spinach shipped from all major districts of origin in 2006. So again, coming back to our spinach example. So this is what we use. This data source is what we use for current consumption. Can you please go back to the previous figures? Great. So we don't know exactly how much spinach from Northern California is being consumed, but we do know how much spinach from Northern California is being exported or shipped across the country. And that's what we use as a proxy for current consumption. And so on the left, we have all districts shipping spinach, and on the right, we've zoomed into the few weeks relevant to the outbreak. And of those few weeks, there are only 4 districts that were shipping the spinach. And of those 4, one was much more likely than the other 3, and that turns out to be where the outbreak started from. So this kind of illustrates the value that you can get through this one source of data. All right, so moving on, that's just have a flow diagram of our model in the next slide, which we're not going to talk about in any more detail now. But our next step is to start incorporating information about the network structure. And we do that, thank you, do that through analytical models where we use, again, these simple stylized network structures, like the one we showed a few slides back, develop expressions to explore the relationship between network parameters and traceback accuracy. So here we have two figures. We'll talk about them one at a time. Starting with the one on the left, this depicts traceback accuracy as a function of the number of retailers reporting. So each parameter on the x-axis is one more number of retailers reporting. So when we have n equals 3 there, that's equivalent to, like we showed in the toy example a few slides back, those 3 retailers reporting. So of course, as the number of retailers reporting increases, the traceback accuracy improves. Now on the right, we have traceback accuracy as a function of the number of outgoing links. So here, each parameter on the x-axis actually depicts a whole nother network where the network has that many more links between each layer. And so as the number of links increase, the uncertainty increases and the accuracy of traceback decreases. So these graphs and the math behind these graphs provide key insights to relationships such as trade-offs that can be really valuable to investigators. So that's what this whole component of our research is focused on, is developing those kind of insights. And then we move on to simulation of much more realistic modeling structures. And this is the part of the project that we're just embarking on now. And so to do this, we're using a Monte Carlo simulation framework that allows us to represent the dynamic nature of these real food distribution networks. And what we kind of are creating, there are two components to the simulation. One is to create network structures that represent foodborne disease networks, and to create multiple of these types of networks with different connectivity patterns. And then another part is to simulate different types of outbreaks on these networks. So outbreaks of various size, origin, case counts, number of people infected, and timing. And once we have all of that, we can test our methodology using these simulated network structures to determine traceback accuracy under various conditions, and importantly, to determine what of these different parameters that we're varying have the biggest influence on traceback accuracy, and how might we be able to influence these through policy changes. So this simulation framework allows us to compare multiple policies for improving traceback and eventually to determine which could have the greatest impact. So, so kind of summarizing what we're doing here, we have, again, our main goal is to improve the accuracy and speed of tracebacks, and to do that through two components. So the first component is to do that tactically to develop an implementable set of procedures that can guide investigators and control measures during actual outbreaks. So this is helping to determine the allocation of search effort, where and when investigators should be sent out, where additional data should be collected about the network of distribution, about additional cases, and when to issue public service announcements, which is a very, very challenging decision analysis problem. And then secondly, strategically, to consider and rank order different hypothetical policies that could be put in place to improve the outbreak response process. So there are a number of possible policy changes. Some that we are considering and that we'll be investigating include strengthening the prior probability model through implementing a standardized data collection and thereby having access to a better set of data to work with in the time of an outbreak. Proactive mapping of network structures for high-risk foods. So we know that there are often outbreaks in certain types of foods, and having pictures of those food supply chains in advance to help us speed the process during an actual outbreak. Improve surveillance and earlier detection of cases through use of more, perhaps, digital disease detection methods. And other more creative approaches, for example, holding samples at a farm and distribution center so that we can test them once an outbreak's occurred. There are many possible policies, and we'll be investigating them through the course of this project. So expected contributions, our project goals are aligned academically and practically, and as we said multiple times, to improve the accuracy and speed of tracebacks. And we've been in touch with the FDA throughout this project, or especially at the beginning stages. And Sherry McGarry, who's the Foodborne Outbreak Coordinator at FDA headquarters, has said that any measure that will help to determine where we should focus our attention and give leads on the investigation will have a lot of application and utility for public health. Messaging could be more targeted because we would be able to narrow down more quickly where the product is not coming from. This could really make a difference early on, and we hope it does. So just before we end, a few words on next steps. This current project phase ends in March, and deliverables that we'll expect by then include a prototype of the simulation model that we're talking about, a detailed list of recommended policies and procedures for improving outbreak response. And then by June, journal articles on our framework, on our theory and modeling work and results, and a paper explaining the whole system as it works together and the potential impact on public health, and a policy brief that describes more in detail about how this methodology might be implemented by FDA or local public health agencies. We would also like to continue to continue dissemination of this project after the grant period ends, and we would like to do that through a couple of different measures, including packaging the methodology into a shovel-ready tool that's really ready for use by the FDA and public health agencies, and then to work with officials at these agencies to reality test the tool, really putting it into practice. And holding a workshop for public health officials to demonstrate how it works, and also developing an interactive visualization for educational purposes. So that's all. We thank you very much for joining us, and really thank you for all your support of the PHSSR office, all your help, and thanks to the Robert Wood Johnson Foundation. And we look forward to our commentary now.
Thank you, Abigail. Thank you, Stan. And so for our commentary, let me introduce you our commentators. First, Greg Gonzalez, who is a PhD candidate in the Department of Epidemiology of Microbial Diseases, Yale School of Public Health, and research scholar and lecturer in law at the Yale Law School. Greg co-directs the Yale Global Health Justice Partnership, an initiative of Yale's law and public health schools, focusing on teaching, research, and policy at the interface of health, medicine, law, and human rights. Greg's doctoral work at Yale applies quantitative methods drawn from different disciplines, particularly operations research, to improve the efficiency and outcomes of programs for HIV infectious diseases. Greg formerly held fellowships with the Open Society Foundations and the Harvard Medical School Department of Global Health and Social Medicine. Our other commentator is Dr. Jared Hawkins, who is a research associate and director of informatics in the Innovation Acceleration Program at Boston's Children's Hospital. Jared works translationally by bringing digital health projects from research into implementation and enterprise. And he also focuses on using social media and other non-traditional digital data streams for population health surveillance, specifically to identify and analyze specific subpopulations over space and time with the goal of better understanding patient behavior and disease dynamics. Jared received a PhD in immunology from Tufts Medical School and a master's in biomedical informatics from Harvard Medical School. So with that, I turn it over first to Greg, followed by Jared. Greg, are you on the line?
Yeah, can you hear me?
Yes, go ahead.
Hi, everyone. So first of all, it was a wonderful presentation by Stan and Abby. And, leading up to this, I was looking for other kinds of work that was related to this, and I found like sort of out there papers on dog treat contamination from China and botulism contamination of the milk supply. There's all these extraordinary examples of using this kind of Bayesian search algorithm or looking at distribution networks to answer these sort of extraordinary questions. But what's wonderful about Stan and Abby's work is that it seeks to integrate operations research and system thinking into regular public health practice. And, when Stan said at the Keeneland conference their work stood out, it stood out because they're taking this sort of quantitative approach to what the challenges that face us in public health. So I want to give people other chances to ask questions, but as I was listening to this, I thought the methodology was interesting and novel, and it's been applied in outside of public health, and now it's being brought inside of it. But I wanted to ask Abby about some of the issues about moving from a toy model into practice, or actually, how much information do you need to get shovel ready? And I think you talked about it a little bit at the end of the talk, but in terms of crafting your hires and understanding the network structure, is this kind of data readily available, or how much time and effort did it take you to dig up just for this sort of toy example, the information you needed to sort of to build it? Because I think we can make policy recommendations that say we need to sort of reform the way we describe the food supply, how we deal with foodborne illness, but in the current sort of policy environment, how difficult do you think it is to get this data together in real time, if an outbreak happened, in the next 6 months or something like that?
Greg, that's an excellent, very important question, and thank you for asking it. So we're doing all of this modeling in the absentia of actual data about supply chain networks. Mm-hmm. And the reason for that is that this information, as I kind of mentioned briefly, is held very closely by these by the different food companies, and the FDA would have access to this information in the event of an outbreak, so they can ask for that information to be shared with them. And they also have access to data on, so all facilities operating in food are required to register with the FDA. They're required to submit their locations and who they're working with, and to update this on an annual basis. And this is information that we don't have, but as we're doing this, going through creating our simulation paradigm, we're assuming that the FDA would have access to this information. So given that, we're trying to create an approach that takes advantage of data that would be available to investigators. However, we're not able to get an exact read on what that would look like since we don't have access to it in the project. That being said, like you mentioned, we can still make, through our modeling, create a lot of, get a lot of intuition into the problem and recommend policy changes as a result of that modeling without knowing without being able to direct investigators in the event of an actual outbreak. Mm-hmm. So does that answer your question?
Yeah, no, I mean, it sounds like, it sounds like you believe there's sort of existing data out there that, although there need to be policy changes to make this more feasible in the long run, that it's possible that, in the short run, you could test it out in the context of contemporary outbreaks using FDA data, which because a lot of operations research is highly mathematical and develops a model, but then doesn't have any sort of imminent practical application. And I think what's nice about what you just said is that you think the FDA does hold data that makes this sort of a feasible, usable tool within the short term, rather than sort of having to have a wholesale policy change to make to put your parameter values in place and all the other information you need. So,
Exactly.
So maybe I just to turn it over to Jared, and then we can continue from there.
Great. Hi, Abby. That was a great talk. Really interesting work. So I just just want to start off saying, obviously, based on my prior work, I'm a huge proponent of incorporating disparate data streams into public health tools, and I think that, as might be obvious, that these data streams are often large, very digital in nature, and require new analytical tools. I've interacted with Abby quite a bit over the last year and a bit more, and she's doing really great work in this space, particularly in traceback detection of foodborne. So I wanted to speak a little bit to the putting this into practice and kind of implementing this on both local and national public health scales. And I think, based on our work in this space, there is a tremendous amount of interest, again, at both local and national levels, for finding new ways to investigate foodborne illness. Abby mentioned that there was underreporting of individual cases, and we definitely see the same trend when comparing the volume of complaints of foodborne illness on social media to the numbers that are traditionally submitted via phone or health forms. And these are, multi-log differences between what is put out there in the two. So just talking a little bit about the acceptance of public health to use this type of approaches. Foodborne Chicago is a really great project out of Chicago that used Twitter to identify users that complained about food poisoning and then reached out to them to obtain additional kind of the minimal information they could use to further investigate. We've also done similar work using Twitter and Yelp. We're applying that in both local and national levels across the country. And I think there's just this hunger for incorporation of these type of data streams, as well as integrating with traditional data streams, such as prior violations or health scores, to then build predictive models to prevent illness, or just better understand what's going on in the current outbreak. So I think that there's definitely a need, and these type of approaches will be welcome by many different. So I think Abby's work is really novel in the sense that it brings a much-needed emphasis to traceback detection, which, as we've seen in this talk, is clearly an important in identifying the source of the outbreak. Most work in the past has been done on prevention. Early detection has some recent work in our spaces as well as some other groups, but traceback has been relatively neglected. So this is very timely. So I think just Abby kind of covered some of the impacts, I think, very well, but just going over them in terms of the value that they'll bring to public health. So timeliness, reducing lag between having an outbreak and identifying where it came from, extremely important, help in many ways, and in particular reducing the manpower burden. So when you combine that with earlier detection, I think right now a lot of the limit of public health isn't knowledge or skills, it's manpower, and I think that will be probably one of the beneficial outcomes to this research. Of course, increasing accuracy, so not wasting time on false leads and detecting new signals that might have been missed by traditional approaches that might have been more narrow. I think in my experience in this space and other kind of innovative health spaces, that applying new methodologies are so really great for getting new perspectives and garnering interest and fostering innovation in general. Kind of that interface between different backgrounds, different skill sets, really leads to some nice work, collaborative environment. And then it makes these tools available to a new audience that might not utilize them, coming from a totally different background. So kind of that interface between mathematics, data science, computer science, and public health is, really paving the way for new collaborations. I think on a lot of areas.
Thank you, Jared. Thank you, Greg. And I guess we're moving to our question. If there's any questions from the participants. I see Anne wants to get the ball rolling by asking sort of a policy extension or dissemination implementation of the model. So anyone can answer it, whether the commentators or the presenters. To prepare for responding to potential outbreak, what activities, partnerships would you recommend for local public health practitioners to undertake, especially within this framework that you hope to eventually have with an applied tool?
So the first, I can start answering this. So the first step is definitely, this tool is very much still in development currently, and an extensive kind of reality testing phase would need to occur where we or someone else who's very comfortable with the methodology were to work with officials at the FDA or at a local health agency to look at this, kind of use data from past outbreaks to test it, and to actually implement it. So we're not creating, as part of this project, a full software system that could be used. We're creating the mathematical theory behind that system and the ideas that will be able to convey that in a set of very specific rules and procedures that a software engineer could then implement. So all of that would have to occur before it's really of use in the event of an outbreak. But we do think that if it is used, it could have a really big impact, and that it would be used alongside other methods. So as we've kind of said earlier, it'd be used during these earlier phases of the investigation for kind of exploratory analysis that would help investigators to prioritize where they should look, where they should collect data, where they should send out investigators. So in that way, it's supplemental.
Can I add to that? There was also an idea that we kicked around. I'm not sure how feasible it is to do something like this, that we could identify a network of limited size, that we could actually do a simulation where we could put some sort of tag on on various of the products and see where these tags wound up. Where, if we're talking about produce, I don't know where we would find a network that's of such a limited size that we could actually implement something like this in a short time. We were thinking about other food modalities other than possibilities, but that's not something that we're actively considering at the moment. But it's something we'd love to have the opportunity to do if time comes.
Are there any more questions from the audience? Go ahead. Any more comments? If not, as moderator, I'd probably want to wrap up the webinar with, I guess, one last question. Just looking back at one of your slides in terms of the modeling aspect of it. I can't seem to get back to it. Anyway, I guess it's one area where I could see you having sort of an extension for the model in terms of, as you try to collect data in informing those prior probabilities using your Bayesian updating approach, is as you're able to trace it back to these farms. Some in the agricultural economic field and agronomic sciences suspect that the reason for some of the prevalence of these foodborne illnesses is due to the growing popularity and you could say, prevalence of organic farming, organic agricultural practices. So I guess in the modeling, it would be interesting to see the model can capture, or be able to quantify the risk of these farms in terms of, if you differentiate them by their farming practices. So obviously with organic farming, you have, higher rates of organic, like for example, manure and waste, and not just risk of pathogen contamination, but also with heavy metals and so on. I think it would be interesting to see if you could assign those probabilities or those risks to those type of farms. I mean, given that, it is something that you can model the whole network from farm to distributor to retailer. So I think that would be an interesting thing to look at using your model.
Yeah, that's a really that's a great comment and a great suggestion. And one thing that I didn't really make clear when describing this prior probability model, I talked about these three risk dimensions that we're using to prioritize and to kind of rank farms as potential sources. And but we're not limited to these three, and we're not food scientists or microbiologists, and there are many other factors that could potentially be included in this prior probability model that we haven't captured, and so definitely kind of looking at other ways that contamination could enter the food would be really important to include as well for specific food types, and like you're saying, these kind of new additions to the food supply chain. So yeah, thank you for that comment.
Anyway, we'd like to thank again our presenters. Thank you, Abigail. Thank you, Stan. And our commentators. Thank you, Greg. Thank you, Jared. And thank you, everyone, also for joining us on today's webinar. Do not forget that this webinar is also available. It will be archived and will be available for download from our website. And also for upcoming webinars too as well. Please do. We will try to keep you updated too on that as well. So again, thank you to our presenters, and thank you to our commentators, and thank you everyone for joining us this afternoon, and have a great day. Thank you so much.